Welcome to the Sky Therapeutics podcast. I'm your host, Tara Torres, a clinical nutritionist, researcher, educator, and consultant specializing in areas of weight loss, autoimmune disease, gastrointestinal disorders, metabolic syndrome, and other obesity-related conditions. I help clients improve their health through proper functional nutrition, professional-grade supplement protocols, exercise recommendations, education, and support using a personalized, evidence-based approach. At Sky Therapeutics, we offer functional nutrition solutions for chronic disease and help our clients develop sustainable lifestyle habits that will last a lifetime. As a friendly reminder, the information and opinions provided here today is to be taken as general information only, and you should always contact your personal physician or other qualified healthcare professional if you have any questions about your personal health and wellness. Hello, and welcome to this week's podcast where we interview Dr. Todd Worley about all things bariatric surgery. Now, if you're wondering why I, a functional medicine nutritionist, am interviewing different practitioners about weight loss medications like semaglutide, which we talked about a few weeks ago, and bariatric surgery, the reason why is because these are some of the clients that I see coming into my office. And so it is important for me as a nutrition professional to understand all of the different weight loss options out there so that I can effectively provide the best nutrition counseling, because sometimes these medications are associated with nutrient deficiencies, and sometimes there's interactions with different supplements, and same with bariatric surgery. With bariatric surgery, we do see alterations in metabolism and nutrient deficiency. So it's important that we offset those with the appropriate supplementation and food recommendations. And it's also important to recognize that there's an underlying theme, no matter which decision you decide, or which tool, we should say, you decide to use, whether it's a medication or a surgery option, there is still the need to address your diet and lifestyle no matter what, to ensure not only the effectiveness of things like medication, but also to ensure long-term results, right? We don't want to have somebody undergo bariatric surgery and undo all of the hard work that they did a year or so. So it's important that while they're going through this major transition following surgery, that they are learning the long-term lifestyle skills that they need to maintain this for the rest of their lives. And that's something that Dr. Worley and I agree on wholeheartedly together. So Dr. Todd Worley is a bariatric foregut and general surgeon in Houston, Texas. He's part of the Houston Methodist Hospital system, and his primary location is in Houston Methodist Willowbrook. He completed his undergraduate education at Texas A&M, medical school at UT San Antonio, general surgery residence at St. Joseph Hospital in Chicago, and a fellowship in robotic and bariatric surgery at UT Houston. Dr. Worley is an expert in bariatric surgery and in the surgical and non-surgical treatment of obesity. His practice is dedicated to helping people achieve better health through weight loss, incorporating how they eat, how active they are, how they sleep, how they manage stress, utilizing medications, or even surgery to achieve their goals. He currently lives in Spring, Texas with his wife, Ann, 2 kids, Isaac and Jillian, and their dog, Murphy. So stay tuned. Dr. Worley, thank you for joining me today. How are you?
Oh, good. Thank you so much for having me.
Great. Well, I am so excited to highlight your services as a bariatric surgeon. And I know some people may be confused as to why I, as a clinical nutritionist and somebody who specializes in functional medicine, is interviewing people about things like semaglutide and bariatric surgery. And really what I want to point out is that this is a collaborative effort between multiple disciplines. And when it comes to you and I think it's very intertwined in what you do. And ultimately, no matter what tool somebody uses, whether it's a injectable or an oral prescription or a surgery, there's still that need for addressing underlying dietary and lifestyle changes. And we'll get into that here in a few minutes. But what I wanted to highlight is bariatric surgery. So bariatric surgery is a medical intervention designed to help people with obesity achieve significant and sustained weight loss. There are several different types that we'll discuss here today of weight loss surgery, and each with its own benefits and considerations. And the choice of which surgery is Most appropriate depends on the individual factors and should be made in consultation with your healthcare provider. So, Dr. Worley, can you walk us through some of the surgery options that you provide and give us little details?
Yeah, yeah. I love talking about this so much, especially in this context, because you hit the nail on the head. The collaboration is key. And if we're thinking about, you know, the terms like weight loss and the disease of obesity, right? When we're thinking about that, it's a spectrum of care, right? And so, there's a place, certainly there's a foundation, right? How you eat, how active you are, how you manage stress, how you sleep, it has to be the foundation. And so then taking it from there and offering it as a spectrum of care, there's a place for surgery, there's a place for medication, there's a place for non-surgical interventions. And so when we think about it like that, right, and also framing it as thinking about obesity maybe as a chronic disease, right? The spectrum has to allow for treatment now and potential treatment in the future. There's really never a one and done where you find that perfect diet and you do it the rest of your life and you're healthy, or that you don't struggle with obesity anymore. And so I think with that spectrum, surgery definitely has a role. And interestingly, I think for people out there to understand, because everyone seems to know someone who's had weight loss surgery, but really only about 1% of all eligible candidates ever have surgery, which I think is fascinating.
Yeah, why is that? Do people opt out then or change their mind or?
I mean, I think it's just hard for them to, well, a couple of reasons, right? First, sometimes when people move or make the decision to have surgery, they'll tell me, I feel like a failure and this is my only option. And I think, oh, no, no, you're anything but. Like, this is a strong move you're making, right? Like, this is a strong tool you're bringing into the mix. You're not failing. It's just a very difficult disease to treat, because there are so many factors, whether it's behavioral,
Mhm.
genetic, environmental. I mean, that you start bringing those kind of factors in, there's so much of it out of control. And people who see other people who are struggling with the disease of obesity or health problems related to that, sometimes mistakenly think that it's a willpower issue, or that there's some cosmetic issue going on. And really, I mean, they're fighting a disease, right? And so then thinking about that, the tools become much more relevant. And then people start to consider that, okay, maybe I can bring this into part of my lifestyle change and make it all work together.
Right. And jumpstart the progress because it's a tool. And at the end of the day, they're still going to have to establish those habits. But if this is what helps them get there and jumpstarts that process, to each their own.
And and yes, and like the myths that exist out there, that this is the easy way out, or that it's cheating, that it's magic, that it's just one and done. I feel like the people that come in with that, I mean, they quickly learn in my practice that, okay, that's not what this is. This is a tool, right? Just like how you eat or a medication that helps you achieve your goal. And I'll ask people, when they're a year or two out, it's always a kind of a fun question to ask them, like, do you feel like you took the easy way out? Do you feel like you cheated? Like, and it's nice to get that feedback, to hear how those myths really break down. And they'll tell me, oh no, especially the people who are very successful, they'll tell you this was hard work, but the difference this time is that the hard work paid off like it never has before. And that is a huge impact, right? And it really speaks to how you can be successful with any modality that you're using to lose weight or to become healthier.
I think that's a correct statement because I'm envisioning some of the patients you and I have worked together with, and the ones that were the most successful were the ones who had the surgery, but they took that effort to pay attention to what they were eating and really make those changes, and not just the amounts, but the types of foods too.
Oh, absolutely. Absolutely. I mean, what you're putting into your body matters so much, right? And we've worked together quite a bit on patients, just thinking through how all of this interplay works together. So,
Right.
um,
So let's dive into the different types of gastric surgery because there's so many different types. And I want to better understand, I want our listeners to better understand what the options are. And maybe you can help point us in the direction of like who would be a good candidate for what, or how do you pick which surgery for which person?
yeah, that's a huge topic, and I love talking about it. So buckle up because it's gonna be I hope very interesting to think about the types of things that we go through with patients and how we choose a surgery. And but let's start first. We'll just talk about the surgery options. And so I will describe them sort of in the order of complexity. And I will say, people will often come to me and say, I want a less invasive surgery. And so, just trying to get us on the same page, I'll think about these first few. They're really the same amount of, we'll say, invasiveness, but the complexity is how it varies. And the more complex a surgery, typically the more risk. And then also, typically, the more complex the surgery, typically the greater payoff in terms of percentage total body weight loss, or effect on obesity related health conditions. And so you have to think about that. I think that ladder of complexity in what you're choosing, and that'll also come into how we talk about these things with patients. But the first one that I'll say is least complex that I offer is the sleeve gastrectomy. And now all of these surgeries that we'll talk about, they're done under general anesthesia. People are completely asleep for them, but we're going to do it robotically. So that means tiny incisions that we go in with cameras and long, skinny instruments, and we accomplish all of this work, right? So with the sleeve gastrectomy, that really, it's like I said, the least complex and probably the most straightforward, because as we think about the anatomy, and the food travels from your mouth down and through your esophagus, it empties into the stomach. And so when I say stomach, I'm talking about the organ proper, not your entire abdomen. So I want to be clear about that. And so whenever we do a sleeve gastrectomy, we remove 75 to 80% of the stomach. And that part, it's coming out of your body. It's gone forever. There's no longer, you won't have access to that. And what happens to the stomach is we're not wrapping anything around it or putting in anything inside of it. We're creating a tubular or a tubularized version of your stomach. And it's sort of the shape of a sleeve. If you're imagining like the sleeve on your arm of your clothing, right? Like it's a tubular structure. And so this can appeal to people because we're not rerouting the anatomy like we do in some cases. But it's powerful in that you're going to eat less because it obviously will restrict how much you can eat. But the real power, I think, that comes in these surgeries that we're still we know a lot about it, but we're investigating even more. And I think even weight loss meds highlight this, is that the effect it has on hormones that impact your hunger, that impact the way that you feel full, which is called satiety. And so they're very powerful, not just on that mechanical making you eat less
Right.
structure.
They want to eat less because the hormone picture.
Right. And they're not feeling as strong of a drive. Exactly. Yeah. So that's the first one. The next one that I'll say will be the next most complex would be gastric bypass. And with this, we're actually going to take your stomach and create a small stomach pouch where we divide sort of the upper small aspect of your stomach from the lower aspect. And then we will connect that small pouch of stomach to your intestine. So the food now will empty directly from that small pouch into the lower intestine, not the colon, but the lower part of your small intestine. And so we're going to bypass part of the stomach and part of the intestine. And so it does, in a similar way, affect how much you eat. So you're restricted. It will affect the sort of the way that your body absorbs nutrients. And so there will be some component of malabsorption because we're skipping parts of your stomach and intestine that normally contribute or help absorb nutrients. And so people do really well with this. This one is actually as of right now, the oldest operation that we have the most data about this. It's much safer than people think, but it is climbing that ladder of complexity. And it impacts hormones similarly to a sleeve, if not even more so, that impact hunger and fullness, especially the GLP-1, which is a hot topic of the day because that's how a lot of these medications act. But surgery can create that same impact. Then the next one up, and I'm going to do this in a sort of a part A, part B, is what's called a biliopancreatic diversion with a duodenal switch. So that's a lot to say. So we will shorten it to just duodenal switch or DS or switch. Sometimes we'll just say switch because the shorthand is a lot easier. The first part's a mouthful, but this one is creating, similarly, we're creating a sleeve, but then we're going to still leave the very bottom of your stomach intact, and we're going to then connect the intestine to that. And so the food will go through a sleeve, like the first operation we talked about, and then go straight into the intestine. But this one's different because we're bypassing much more of the intestine. And I think the very early days, up until maybe the last few years, this operation probably, well, had a bad reputation, right? We can say that because I think people were bypassing too much intestine because they were having issues with malnourishment, absorption. Now that's part of the way that the surgery is designed. It is the strongest for weight loss. It is the most complex. It brings the most risk, but it's the most powerful for things like diabetes by far. And so sometimes, why would someone choose to take that risk? Well, sometimes their disease of obesity is so severe that we need the strongest tool, or that their diabetes is so strong that we need the strongest tool. And so that can be partly what helps make our decision. But this surgery's gotten a lot safer because of the part B that I'll talk about, where we made some modifications to that to make it safer for people. Less issues with protein deficiency, malnourishment. And so what we did is really bypassed a little bit less. I think you could say that in essence. And instead of two connections, like in the DS, you only make one connection with the intestine. And so I think the lessons that we learned from that also informed the DS, or how we do the switch, and made us start making that a little bit safer because we don't bypass as much. And I think this is an operation that if we start thinking about this modification, which is called SADIE, and it has a very long name, single anastomosis duodenal-ileostomy with a sleeve. And so we call that one SADIE for obvious reasons. And but I think those modifications, making it safer, makes it much more appealing. Surgeons are even like myself are much more inclined to offer it to people. And but again, when do you offer these things? I think if we're thinking about a spectrum of care, someone who's had a sleeve before and maybe they've really struggled and they've regained weight, it is nice that we have options like a SADIE or a DS to offer them, to sort of offer them the next step in their journey or another tool, rather than saying, sorry, you had your surgery and there's not much we can do, right? I think it's important to think about these surgeries as people need to have future options. So those are the surgeries in my practice. I'll talk about a couple of other things, but yeah, those are the surgeries that we offer in our practice.
That's interesting. And I think it's important for people to understand that if you failed a prior type of bariatric surgery, you're going to be more inclined to take a higher risk this time around, but also understanding the severity of obesity and how that's impacting overall health, diabetes, high cholesterol, high blood pressure, those types of things are certainly going to make you want to take stronger action, I think.
Yeah, that's a really intuitive point that you're bringing out, is that sometimes, it's scary to go from, maybe not having surgery or just having diet and exercise, going to the most complex surgery right away. That's hard to wrap your mind around. And I think sometimes, if you choose maybe like, let's just, for example, you choose a sleeve and it is less risky, it does bring a little more security to patients because they don't feel as scared to do it. And so then if they were to struggle, say 10 years later, they have that to say, okay, I did this before, right? I have trust in my doctor. I've gone through this process before, and I just happen to need a little more help. That it's not so scary, right? I mean, no one's really doing this planning on 2 surgeries. I'm not planning on 2 surgeries. We're hoping this is the only thing that you need for the rest of your life. But as we talk, you and I, through this podcast, there are ways to help better your odds of making this the only thing that you need, the only surgery that you need, I should say, for the rest of your life. So.
Right, right. And so you had mentioned before we started recording that there were some other options that you don't necessarily provide.
Yeah, that's true. That's true. And there are other surgical or procedural based options that exist. And we'll talk about some. The first one is the gastric balloon. That is where we actually put an inflated balloon, could be with fluid or could be with air, inside your stomach to take up capacity, take up space, to make a person feel full. And what it does is help them eat less, help them feel full faster. And it is FDA approved. The hard part, compared to the other options that we just discussed, the ones that I do offer, the gastric balloon is not covered by insurance, and that makes it tricky. Whereas the others typically are. If you have bariatric benefits, those that we discussed are typically covered. Gastric balloon is not, and so people pay out of pocket, and that can be difficult. That's an instant barrier for a lot of folks, understandably so. And the other part is our weight loss medication, which there's no way to have this conversation without mentioning those, are probably, well, at least as strong or stronger than a gastric balloon. So why would anyone ever choose that, right? Well, there are some people where those medications are contraindicated or not allowed. Sometimes there are other barriers, whether that's cost or insurance, that may make someone choose that. A difficulty with the balloon is it's only approved to be inside of your stomach for 6 months. And so typically the way a program will work is the balloon is placed, you start feeling the effects, you're eating less, you're losing weight, but also you're working with a nutritionist or dietitian. You're working maybe in some cases with a psychologist and with your doctor to try and build good habits during those 6 months, so that when the balloon is taken out, these programs are supposed to continue for 6 more months if we're really optimally treating patients the way that balloon has been designed, so that we keep those habits going for maintenance. But you and I know, whatever the thing is that you're doing to lose weight or better your health, however, once you stop doing that thing, whatever it is, typically the weight comes back. And so that's where it comes in. A lifestyle and a collaborative effort is huge, right? So that's balloon. The other that I would mention is the endoscopic sleeve gastrectomy, or ESG, or gastroplasty. Sorry, I should say endoscopic sleeve gastroplasty, because gastrectomy would indicate we're taking a part out. Gastroplasty would be more indicating that we're remodeling that. And that is a procedure where under anesthesia, your surgeon or doctor will go in with a scope and really fashion your stomach as a sleeve on the inside with a series of stitches or sutures. And so you pull this stomach in, shrinking the capacity, restricting how much a person can eat, really driving those hormones that make you feel full. And what is appealing with these two procedures, balloon and ESG, which we'll call the sleeve gastroplasty, is that they're reversible, right? You can undo, whereas the surgery we talked about beforehand are either not reversible or not easily reversible, whereas the balloon and gastroplasty are. And I think they're worthwhile. I think they do have a niche. ESG is similar to the gastric balloon, is that insurance really doesn't cover that. I'll say right now, I could see that happening in the future. But yeah, they can be reversed, whether you take the balloon out or you cut the stitches. You also, which I think is important, like we mentioned with the spectrum of care, is that it allows for future options, which is huge, right? If we're treating a chronic disease. So.
Okay, so what are some of the risks or adverse events that somebody could expect from some of these?
Yeah, so the first sort of short-term risks that we'll think about would be those that are really inherent with surgery, right? Whether we're talking about potential for bleeding, the potential for infection, the potential to have blood clots, right? Those, I mean, they're scary things. There's another that you really introduce with sleeve, gastric bypass, SADI, or switch, would be the potential to leak where we've reconnected the stomach or connected the intestine to the stomach. I mean, you have the potential to leak there. Now, the good news is with those things, that risk is really, really low. I mean, we're talking about with all these things, usually 1% to 2%. And some of that varies depending on the health of the patient, what other issues they may be struggling with or diseases. And so I think if we're talking about that perioperative risk or that risk around the time of surgery as 1% to 2%, and we know what things to think about, we take a lot of preventive measures. So we give antibiotics, we give medication to prevent blood clots, we escalate your diet very slowly and methodically over about 6 weeks to make sure that we're not putting too much pressure on those connections. And with those things, we've been very successful at minimizing and decreasing the odds of those things happening. But the other thing that's great about it is once your body has healed, those risks really are not in play anymore. If something similar were to happen, generally there'll be another reason. And so the short-term risk is that, but that part fades as you heal up, which I think is great because I don't want people to think I gotta worry about this part the rest of my life, you know. But there are things that you worry about for the rest of your life. And one of them could be malnourishment. As we talked about that ladder of complexity, right? That risk goes up from sleeve to bypass to SADI and switch. And so we're always cognizant of that. And all of our patients take bariatric quality, higher quality vitamins just to make sure we're picking up the slack for them not being able to eat as much, or for those patients that have an element of malabsorption, that we're countering that, because we'll still worry about vitamin B12 deficiency, iron deficiency leading to anemia, even protein deficiency in some of these operations. And so we think, okay, how do we counter that? And so those are things that we work on. And that's why lifelong follow-up with your team, and I'm going to say with your team, is vital, right? It's what's going to make or break this typically for most people, because there's accountability and reinforcement and help, right? And so what else? Well, say for instance, there's a sleeve. Well, probably the most common thing that people worry about is GERD. With a gastric bypass, you bring into the mix ulcers or special types of hernias. And then with the switch or the SADI, the most worrisome thing is malnourishment. So, right, they all have their different risks. And I would say, you know, whatever you choose, right, it has its own set of inherent risks. but
Mhm.
we try to minimize those as best we can. And there are steps that we take in collaboration with the rest of the team to make sure they don't happen as best we can. And so the odds are still low, right? But they can happen.
Right. And there's ways that you can offset nutrient deficiencies and working with a nutrition professional who can highlight better quality foods that are going to provide you those nutrients. I would rather see somebody eating nutrient dense quality foods than say KFC or Whataburger all day, every day. Like, yes, they're eating less amounts, but they're not getting the fiber and the vitamins and the nutrients that they need to help them heal from surgery and just maintain normal day to day function.
I don't think you can emphasize that too much. I mean, right? What you're putting into your body is going to be critical to this being successful. Yeah.
And then there's some cons, but there's also pros. It seems very effective for weight loss. It helps. And if with weight loss, we're going to see improvement in all these other comorbidities like diabetes and cardiovascular disease. Um, it seems to have long-term outcomes, right? And psychological benefits for people.
Oh, for sure. For sure. Right. I mean, when you think about, right, if you understand the risks and you say, okay, these risks are low, and then you understand the payoff or the benefit. I mean, they very clearly, for most people, at least from a theoretical standpoint, outweigh the risks. The benefits far outweigh the risks. Now, right, and I say theoretical because each patient is an individual, and they think about these things differently, and sometimes the risk feels worth it and sometimes it doesn't. But if we think about the payoff, let's think about that. So um, it is a solution that creates really very durable weight loss, right? That with the proper guidance and sort of other aspects of your health at play, people can maintain their weight loss for the rest of their lives, right? And we have so many people who do. um, Now, I will say the statistics are that 1 out of 3 people will regain weight of some sort after about 5 years out. And I think, when you're dealing with a disease that has so many factors, or what we say is multifactorial, genetics, environment, behaviors, um, just even your community, the people you surround yourself around and their habits, they all play in. And so, yeah, I mean, if someone were to um, maybe, as we talked about just now, not eat reasonably well, and they don't incorporate more activity into their life, certainly they're at risk for regaining their weight. But I always flip that and I say, well, okay, so 1 out of 3 can, but 2 out of 3 don't. And I think that's better than any standalone diet that we just try. It's better than exercise, right? And so if we think about it from a percentage standpoint, it wins, but it's not meant to win alone, right? We're not actually comparing these things one against another. We want them to work together, right? That's the magic, actually. Um, and so yeah, so if you can pull all of those things together, you're going to have a very durable result. But then also, if we think about, other health related or obesity related health conditions, like diabetes, there's probably a 70 to 80% chance that's going to go into, and I'm going to use the word remission, right? Not, we're not going to cure it, even though it does feel like that actually. But remission meaning, okay, this disease was inextricably tied to your weight in many ways. And so then when you lose that, and we sort of optimize the hormonal function in your body, then right, there's a chance that diabetes it's almost as if it's non-existent in your body. Now, that said, I say remission because if you were to regain weight, typically the diabetes will come back. But that's just an example. And hypertension or high blood pressure is probably 60 to 70%. Sleep apnea is probably 80 to 90% put into remission. And then a term that I know that you and I have talked about, right? So it can extend people's lives But we don't want to just extend life, but have that life be poor quality. We want to extend life and be good quality, right? And have some of those diseases go into remission. And that is increasing not just your lifespan, but the term that we talk about oftentimes, your health span, right? And so that those years are, more years, but those years are better quality as well. And so those are huge payoffs for people.
Better quality of life. They want to be around for their kids, their grandkids, and they want to be a better example for the people around them. And that's also something to mention in being successful. And no matter if you're following a diet or taking a prescription or doing bariatric surgery, but I always tell people to start surrounding themselves with like-minded individuals, because we live in a culture. I mean, let's face it, America lives in a very fast-paced, fast food driven world. And if you are the only individual in your community, whether it's your friends and your family or something bigger than that, pursuing a healthier lifestyle, it can be very isolating. And I think that's why we, as the professionals in our areas, work so well together, is because we're trying to provide them the psychology or the psychologist, you as their physician, me as their nutritionist, but also it's beyond that, like your family members, who you're seeing on social media. I tell people, unfollow anybody that's not contributing to your goal right now, and start seeking out people who are doing the same thing as you, or who have struggled like you. And sometimes that's binge eating. Sometimes it's just weight loss, so I think it's important that patients understand the long-term commitments associated with bariatric surgery and the potential complications. So thank you for reviewing all of that. And, the need for long-term supplementation to offset some of the nutrient deficiencies, because that is going to be the trade-off. There's going to be pros and cons to any weight loss program, but there's ways that we can go about that with quality supplements, nutrient-dense foods, and this is something we both do in our office with nutrient deficiency testing, and then recommending professional grade quality supplements. And so I think the takeaway points for our listeners is the need to understand that before undergoing any weight loss surgery, individuals should consult with a bariatric surgeon like you and their entire multidisciplinary team, because sometimes they need cardiac clearance and other things, or they have other conditions that we need to get clearance for. And look at their eligibility through insurance. I think that's a big one. And discuss the appropriate surgical option based on their medical history, their preferences, and just individual circumstances. Additionally, post-operative care and lifestyle changes and dietary modifications, including exercise, are crucial in the long-term success of weight loss surgery. So if anyone listening to this is interested in bariatric surgery, or knows somebody who's interested in bariatric surgery, I would just encourage them to look at all of these different facets before finalizing any decisions. Do you have any key takeaways for people?
Yeah, I agree. Everything you said, like I would love to I wish I had a sign that pointed this direction and said, yes, she said it. Yes, because you nailed it, right? If I was going to give one takeaway from this, is if you are struggling with your health, and that's in any way weight related, right? Don't be afraid to get some help. I mean, so many people try to do it alone, and it is so hard. And the isolation that already brings that already brings upon people, combined with sort of like the lingering effects of the pandemic, it is such an isolating thing to take charge of your health alone. And there are people that are like-minded. I mean, that's how we found each other's colleagues. I mean, we feel very similarly. I don't just think I do the surgery and we're done. And you typically don't think, oh, follow this diet and you're done, right? We're thinking about the big picture here. And so there are people out here that will help, that can help in every facet, whether that's mental health, eating, activity, surgery, medications. We have so many tools, and I think now more than ever. So yeah, just find someone who can help. There are plenty of us.
Well, thank you so much for joining me here today. I so appreciate your knowledge and your expertise in this area, and I'm looking forward to having you on again. Maybe we can talk about some of your personal interests in diet and functional medicine. That's a conversation for another day. But
For sure.
again, thank you so much for joining us.
I had a great time. Thanks for having me.
Awesome. Thank you for listening to the Sky Therapeutics podcast with your host, that's me, Tara Torres. If you enjoyed today's podcast, be sure to check out any bonus info and links in the show notes. You can visit us at www.skytherapeutic.com or find us on social media because we love connecting with our audience. Until next time, be well.